Going to be talking about immunizations. So we're just going to kind of briefly talk about immunizations, and then you're going to have to do some research and go over to the CDC and look at immunization schedules and things like that, and then be trying to memorize those and things like that, because you will see immunizations on your exam. There's no real easy way to do it as far as talking. It's more just kind of memorization of that immunization chart. When looking at infections and immunity, this affects nurses greatly. Communicable disease is acquired from a person or an animal through contact with body fluids. So things like kissing, sneezing, blood, or coughing. And if you think about infection control, kids aren't too great at that. So you have direct transmission, and that is directly from the person or the animal. And then you have indirect transmission, and that's where it's acquired through contact with a contaminated object, or things like ticks or mosquitoes, something that carries this infection or disease. So infectious disease is any communicable disease caused by microorganisms that are commonly transmitted from one person to the other or from an animal to a person. So when we think about that, we want to think about immunity. How can we stay safe from those infectious diseases? So there's active immunity. So you have that natural active immunity. That's where the individual becomes ill and the body develops antibodies against that organism. And then you have acquired active immunity. That is where vaccines come into play. So body created memory B cells from that altered form of that virus or that bacteria in that vaccine is acquired. So the body creates these memory cells based off of the exposure from that vaccine. And then you have passive immunity that is passed from the mother, and that happens through the placenta in utero, and that lasts about 6 months, or they can also obtain it by breastfeeding. And you can also acquire passive immunity by infection or an IV administration of those immunoglobulins. Infants and children are very vulnerable to these infectious diseases, and that's because their immune system isn't fully mature at birth and immunization is incomplete. Immunodeficiencies can happen, or maybe poor health. Poor hygiene of young children also comes into play. So, you think about fecal to oral route, kids don't wash their hands, they touch everything, and everything goes in their mouth. That's how they learn. So that's why they're more vulnerable to these infectious diseases. When we think about outbreaks, there is an increased incidence of rates of vaccine preventable diseases right now. Parents aren't vaccinating like they once used to. Something that we've seen in our area is outbreaks of pertussis or whooping cough. So that was almost eradicated due to vaccines, but now you see some of these infectious diseases starting to creep back in. So there's also some provider barriers, such as clinical knowledge deficits and an increase in number of vaccines, and also the supply of the vaccines. And then you have that parent and patient barrier. So lack of access to that healthcare, transportation, financial issues, the lack of knowledge, and then the vaccine safety concerns. So it's your job as a nurse to educate. So educate about the vaccines, educate about these infectious diseases, and what can happen without vaccines. I feel like that's a really important component to pediatric nursing. As a nurse, you need to be up to date on the immunization schedule. So I want you to take a look at those here in just a little bit. It's also going to be your job to provide education about the benefits and the safety of the vaccines. You're also going to be assessing for immunization status with all of your patients. You're going to educate about adverse effects, and educate about allergic reactions and interactions with these vaccinations. This time, I would like for you to take a look at the immunization schedules. So you can click on the following links that will take you to the CDC, and it will give you those immunization schedules. You will be seeing some of these on your exam, so make sure that you're studying them and getting a good grasp on when vaccines are to be given. And then you also have another link over here with the contra indications of vaccines. So be sure that you explore that as well. Times when children get vaccines, they also get Tylenol and pain relievers. So keep in mind that parents should be taught never to give a child aspirin after a vaccine. And that is related to Rye syndrome. If they're having a viral episode and they ingest that aspirin, this can cause them to get this syndrome. So it's an acute metabolic encephalopathy. There's a fatty degeneration of most notably in the liver, brain, and kidney that leads to dysfunction. So there's 5 different stages. You've got the first stage, which is lethargy and vomiting. Then the second stage entails combativeness and confusion, coma, and that posturing, and then you're going to get that decelerate posturing in the 4th stage, and then the 5th stage is seizures, loss of deep tendon reflexes, and respiratory arrest. So as far as this goes, hypoglycemia is one of the earliest signs that the patient presents with, especially if they have an abrupt change in their level of consciousness and a history of a viral disease with a sudden onset of vomiting and mental confusion. You've got liver enzymes and ammonia levels that are going to be elevated. Their PT is generally prolonged, and their liver biopsy shows fatty deposits. So you want to, with Rye syndrome, if this does occur, you want to definitely be trying to control that cerebral edema. That is very key, and that's used. Medications used for that are steroids and mannitol.